Several months ago when we were really having a lot of conversations about reimagining public safety, what do you do when in regards to police violence and police shootings, there was a conversation that it needs to be treated as a public health issue. And you took part in a peer-reviewed study by the Lancet that found that more than half of police killings in America are actually not reported in official government data. So we don't even have an accurate snapshot of this. It also found that Black Americans are more likely to die from police violence than white Americans. I don't think that comes as a stunning surprise to people. You say that police violence is a public health crisis. Do you believe that? And what actions, should policymakers be taking to reduce these numbers? There was all this talk about a massive policing overhaul bill, and there are a lot of negotiations, but it seems to have kind of been pushed to the side for now.
Yeah, it's police violence is for sure a public health issue, and then we need to discuss it. And yes, everybody knew there are underreporting of mortality or killing by the police in the United States, but now we're able to document it. And of course, that's what we do at IHME. If you can't measure it, basically you can't fix it. And it's very important to put a number out there and say we need to deal with it. But to come back to your question, what should we do and how we move forward? We need to change our way of doing policing in the United States. Our police force has a lot of weapons. They're trained in their training is it will escalate and you need to be ready to take care of yourself, protect yourself and shoot. And then we send a police to a place sometimes that are ill-equipped to deal with it. For example, you want a police to go to somebody who's robbing a bank with a gun, but you don't want to send a policeman to a house dispute where a husband and wife are having a fight, or a homeless person, or somebody who has a mental health condition. We never had to kill anybody in our hospitals. Our nurses, our social workers never had to kill anybody. They can deal with it because they're properly trained to do it. And we need to revisit that in the United States.
All right, Dr. Ali Mokdad, thank you so much for your insight. We appreciate it.
Thank you.